Welcome to our World AIDS Day celebration today. Welcome to Dr. Wole Ameyan as we are about to get started here. We appreciate everyone that has joined us and will continue to join us as we have a series of virtual events to honor World AIDS Day today. For those who don't know me, my name is Dr. Rachel Vreeman. I'm a pediatrician and HIV researcher. I'm also the chair of the Department of Global Health at the Icahn School of Medicine at Mount Sinai, and I'm the director of the Arnhold Institute for Global Health here at Mount Sinai as well. It's my great pleasure to kick off our virtual celebration of World AIDS Day today, December 1. I'm delighted to have with us a guest from the World Health Organization, Dr. Wole Ameyan, who's going to talk with me and answer some questions as we consider what the HIV epidemic looks like for the world's kids. And then we have a number of things set up in our series of events today, including a chance for you, everyone who's joining us, to also hear from our collaborator of ours in Kenya with our work in East Africa, to hear from a number of providers of HIV care for adolescents and youth, as well as adults who are joining us from here in New York City. And I hope throughout all of this, we'll be able to really honor and really spend some moments together thinking about what it looks like to be living with HIV, to consider how we've had losses, so many over the years from HIV, and what this looks like in the midst of the pandemic today. Even as we start this, because this is, for me, such a, in some ways, such a sacred day, such a special day to really pause, and I appreciate everyone who's been able to join us in that pause today. I wanted to start for one moment with a memory that I try to share and talk about every World AIDS Day. So I've pulled up a picture here. This is Faith, and every World AIDS Day, I tell Faith's story. So I'm going to take a moment to do that before we move into our discussion. Faith was actually the very first child that I lost from HIV. And I remember her just as she is in this picture, sitting next to her mother on a little bed in the hospital in Kenya, where I've worked for a number of years. They're at the pediatrics ward. And her mother is actually really pleased that they've reached the referral hospital. She thinks that if there's anywhere to have hope, this is where it is. But when Faith came to the pediatric ward of our hospital, she was 4 years old. She's 4 years old in this picture, but she only weighed 4 kilograms. That's 11 pounds. Now, most babies weigh 11 pounds before they're 4 months old, but Faith was much, much older than that. And underneath all of these layers of clothes, she was tiny and she was really sick. And of course, she was too sick to be, relieved or pleased or really do anything except try to survive at this point. And Faith died, unfortunately, 2 days after she was admitted to our hospital wards. And I'd given her mother a copy of this picture that I had taken of the two of them. And what I'll never forget is that when Faith died, her mother thanked me over and over again for making this picture of her daughter, because she didn't have any other pictures of her daughter. And she was incredibly grateful. She asked me to remember Faith and to share her story, which is what I've done. And I just felt terrible because I felt like I hadn't done anything. I hadn't done what I most wanted to do, which was to keep her daughter alive. So every year when we celebrate World AIDS Day on December 1, as it is each year, I remember Faith. And I remember her not just because she was the first patient that I lost to HIV, but I remember her and honor her and celebrate her because December 1 was her birthday. She should be 20 years old today on this World AIDS Day of 2020. And so, there's a gap in my heart when I think about December 1 and World AIDS Day, and I think about Faith, who should be having a birthday. And I think about all of the kids and the adults who should be celebrating birthdays with us this year. And I know that we've had a lot of losses as a global community this year to COVID as well. And I think as we gather for this World AIDS Day and commemorate, a different kind of pandemic that's had massive impact over the years, we want to hold and honor these losses as well, even as we honor the many ways in which children and youth and adults are doing so much better. And really, Faith's story is actually a story about what it looks like to be able to access a healthcare system. Faith didn't have to die. If she had been able to get into our system earlier and to get the medicines, the antiretroviral medicines that people take and can live with and thrive with when they have HIV, she should be a 20-year-old honoring World AIDS Day with us today, laughing and dreaming and ideally, in school or studying from home and thinking about her next steps as well. And we know how to prevent kids like Faith from being infected with HIV. If her mother had been able to start HIV medicines during her pregnancy, Faith would not have been infected. So even as we struggle with this current pandemic, we have to remember that AIDS is not over either. And I'm glad that we're taking this time together today to remember that there are millions of people living with HIV today. And of course, we've lost millions more who've died from HIV, and we want to pause and honor them. We want to think about what it looks like for the kids like Faith who are still alive in places like Kenya and places around the world who, are now 15 years old, 16 years old, 20 years old, like Faith would have been, who are coming to grips with what it looks like to live with this virus into adulthood. And that's why I'm really so privileged that we could have with us today. I'm so glad that we have with us today Dr. Ameyan from the World Health Organization to help us think globally about what HIV still looks like for adolescents and young adults who are living with HIV. Let me take this off of the screen here so we can fully see Wole and I as we're talking here, which I really appreciate. Thank you again for joining us today. I really appreciate that. And so let me give a brief introduction to you, Wole. And for everyone who's joining us, let me just note, we do have the ability to ask some questions. There's a question and answer box that you can type your questions into. At the end of our time that we have together, we'll leave some time to pause and answer some of those questions that you might have. So we appreciate that as it goes. So Dr. Wole Ameyan is an adolescent HIV specialist. He has really wide-ranging experience in program and policy areas. He's trained as a medical doctor. He has a master's degree in international public health. He's worked for more than 10 years with adolescent HIV in diverse working environments. He's worked with government ministries, nonprofit organizations, or NGOs. He's worked with the United Nations, and he has extensive experience working closely with government agencies of health for effective programming that would improve access to quality HIV care for adolescents. Exactly what it is we need to be able to bring kids like Faith into adolescence and into adulthood. Currently, Wole works at the headquarters of the World Health Organization, the WHO, in Geneva as the adolescent HIV lead. He focuses on service delivery and spanning from the prevention of HIV to treatment of HIV, and he's particularly interested in evidence-based service delivery interventions. He's also truly a strong advocate for meaningfully engaging adolescents who are at risk for HIV or who are living with HIV in all facets of HIV programming globally. So we really appreciate how he brings into his work globally and at this global policy level the voices of youth and adolescents. And it's really our delight to have him with us today. So I really thank you for that, Wole. I wondered, could you maybe start with giving our listeners and those who are joining us virtually a sense from your perspective of how children and adolescents who are living with HIV right now have been affected by this last year? A big question, I know, but to start with the broad picture.
Yeah, thanks, Rachel. And probably to just start by saying thank you for having me. It's a great pleasure really to be able to be with you, speak with you on what is a very important day for all of us, but particularly for people who are living with HIV. It's great that as well we can share stories. I've seen the picture of Faith. You look at that and that touches your heart. The people who haven't made it. And this is a day that, as we celebrate progress, we also, remember really people that we have lost to this epidemic. My work on adolescents living with HIV, like you said, spans prevention and treatment. And over time, we've been able to see, while we have seen progress, we've also seen, even before the COVID pandemic, that adolescents, have it worse. They have it worse in terms of, adherence to antiretrovirals. They have it worse in terms of retention in care, viral suppression, but also service delivery, how, services, critical services are provided to them. In many settings, services are not provided in the way that they should be for adolescents with HIV. So before COVID, we already had these barriers, these problems for adolescents with HIV. What has happened with COVID is that COVID has exacerbated, these barriers. It has exacerbated all of the issues that we saw even before the pandemic, but particularly for adolescents with HIV. In particular, the continuity of services. So we know that it's really important for adolescents to be able to, continue receiving the services that they need, the antiretrovirals, but also other services, including, mental health, sexual and reproductive health services. What we have seen with COVID is that, with the movement restrictions, these services have suffered, and the continuity of these services have not been able to be continued, if I can, for adolescents living with HIV. Now, we know that for adolescents, beyond the interventions and the continuity of services themselves, they thrive on, on relationships and connections, with peers, with parents, in schools, and these, of course, have taken a hit, possibly, what we're seeing as well with, the mental health and psychosocial impact that it has on adolescents. So that's how I would frame it. I would frame it in a way to say that before the COVID-19 pandemic, there were really serious issues. COVID-19 has exacerbated in a negative way those that we know existed.
Sure. I do think that's so true. There are already these many ways in which adolescents, especially, we see struggling through these challenges of how to, of course, become an adult generally, but how to figure out how to manage their medicines in the middle of that, how to come to grips with this illness, how to, navigate changes in relationships with their peers. And throughout all of that, what really is so often their lifeline in that are their social relationships and relationships with their peers. So having that stripped away by this separation that we're having around the globe as we try to distance, and we have lockdowns and these things, I think it really does exacerbate that in so mmany ways. Thank you for that great overview for what we'll try to keep digging into during our time together. As I started with sharing a story from my path in terms of, one of the many patients who's helped me understand what it looks like to bring up service delivery for children and adolescents living with HIV, and what it looks like to really try to do, research that informs how we do that, for working on building systems that do that better in places like Kenya, where I've worked mostly. I wondered whether there was any kind of story from your path as you've been on this really interesting journey into finding yourself now and moving into the position where you are at the World Health Organization with this global role for how you move forward programming and services for adolescents living with HIV. Any touch points or a story that you'd like to honor today, whether from your own life or from someone that you've worked with?
Absolutely. So there are many of those stories, but like you showed with Faith, there is one that sort of creates that spark
Mhm.
in your head, and makes you then go forward and say, okay, this is the path I want to go by. This is the path that I choose. And mine was in medical school, and that's the image. Just as I see faith, it actually brings back that image. From medical school. I think it was in my 5th year when, and usually, we have these postings. In one of the postings in obstetrics and gynecology. As a medical student, we stay at the back of the hall during clinics, to observe, what is going on, without speaking. Usually, after the patient comes in, after that we can then, ask questions, but we sort of observe. And I remember, someone coming in, a patient, walking in. In my head, and from what I observed, I thought she was maybe 14, was what I thought. But she was older than that. The history that she was about 17. But she came in and, really looking quite depressed, actually. Shoulders slumped, head bowed. What struck me as well was that, she had a child, carrying a small, quite a small baby. Even remembering it is quite a bit, carrying a baby, but also was pregnant as well. And that was why I went to the clinic. The totality of my experience when I saw, what she went through, the story that she told, or the lack of it, because she wasn't, really confident to even tell her story at the beginning. I came out of that thinking, even though she came in for healthcare, I knew that, there was something missing. This wasn't just a story for health. She didn't just need health. It was more about well-being.
Yeah.
And in many ways, I still look back thinking that, even though she received the health care, there was still a lot that was missing from what from what she really needed at that point. So my mind was made up after that. It's created that spark in me to say, okay, I think I want to go into a part of medicine, public health, deals with, not just health, but all of these sorts of structural, environmental issues that relate to health. So as soon as I finished from med school, took some of my exams, I went to Liverpool, did my public health postgraduate studies, and I began thinking of how I can contribute. So first of all, I worked with governments, I worked with the ministries of health, because it's important. Those are the units by which change, the sort of change that we need, are sort of implemented in terms of policies and practice as well. So working with the ministry, I worked a bit with research, because like you said, it's important. Research is also very important, and I worked with countries within sub-Saharan Africa, with implementing partners, NGOs, before then, getting this incredible opportunity, I have to say, with the World Health Organization to chart a course really for adolescents living with HIV on a global scale.
Yeah, I think there's so much there that I can, that sounds like my own story in certain ways as well, in terms of, having this sense of how can I be not just a pediatrician for this child and family in front of me, though that was always and has always been important to me too, but how can you help to support building systems that let you be a physician or a pediatrician for thousands and thousands of families? Or what does it look like to do that, to care for families across a whole country or across multiple countries, and truly like around a globe, and in the way that it is for you? I think too about, when we, of course, the medicines for HIV have been the critical innovation and requirement, across these, 30 plus decades of us as a global community figuring out how to fight the HIV pandemic in this way. That, of course, with these medicines, it transforms HIV from something that's an emergency killing our patients to something that you can live with. But at the same time, just as you're pointing out, that's not, the medicines, of course, are not, they're not enough. It's not the only thing that's needed for health, for true well-being. That yes, we need for people who are infected with HIV to have these medicines, but then there's so much more. And I think especially for adolescents, as we've seen, it's those issues around it, that there are the supports in terms of finances, of food, of shelter, of school, of being able to have the kind of social and mental health support that's really needed in that. And of course, one of the global topics for or kind of themes for World AIDS Day today is building resilience in this. And I think it's especially, something we really consider as we consider adolescents who are living with HIV. So, I think considering these mental health challenges for adolescents is really a critical area, as you point out too, in terms of how we support adolescents living with HIV on their path to becoming resilient adults. And I wondered, could you talk a little bit about some of those mental health challenges that you start to see emerge globally as we have this really newer generation of youth who have grown up with HIV and now are facing a number of mental health challenges, and particularly as they're trying to manage their health in situations with social isolation, where there also continues to be real stigma around HIV. What do we see in those mental health challenges, and how do you think we might support adolescents in that?
Right. I think mental health in general, I feel like there's not enough being said about it, but particularly for adolescents living with HIV, it's even, like we see for other interventions, it's perhaps even worse. I think at the heart of it, or one of the things at the heart of it is stigma. It's quite surreal, actually, that years and years, decades into the HIV epidemic, the AIDS epidemic, there is still so much stigma, in many settings. And the stigma for adolescents, it's sort of double stigma, because got stigma as a young person. So they're an adolescent, there's that judgment, in terms of you've got HIV, you're pregnant, there's that judgment and stigma as adolescent. Now, when you combine that with, living with HIV, there is a lot of stigma surrounding HIV. That is sort of, a double whammy for adolescents living with HIV. And of course, that results in isolation. It results in not wanting to disclose, of course, because disclosure is a choice. But when you feel that you don't even have that choice to make, then that can be suffocating in many ways. What we find as well is that the burden of mental health, and that relates to a lot of the sorts of issues that I mentioned on stigma. The burden is quite high. It's not being said enough. It's not being given enough attention. But we've seen that up to 50% of mental health conditions in adults would have started by the age of 14. Up to 75% of them would have started by 24. So that tells you that even in terms of sheer burden and the need to focus on this is actually, really there. And we know as well that, having a mental health, disorder, actually, increases the risks of adolescents to depression, to anxiety, the sorts of illnesses that we know, then make it challenging as well for them, especially those who are on ART, to adhere to treatment, to be retained in care, to live a life that is full and whole, if you see what I mean. And these are the sorts of challenges that we see, stigma, the mental health disorders themselves, but of course, the impact that then has, the cascade sort of impact has on living, on their well-being, on interacting with, the everyday interaction, that we take for granted, these sorts of things, and just feeling, within yourself that, you're not coming to the table on equal footing. That's really hard as well. So what is important is that we speak about it more often, because, like I said, it's not nearly being spoken about as often as it should. So we need to, use our platforms to speak about it, remove the stigma, or at least, reduce it significantly, the stigma that comes with mental health, with living with HIV, and giving people, the chance to also, if they want to speak about it and to prefer solutions. For me, this is really critical, and moving forward, having seen what I've seen in the last few years, but particularly this year as well, where at WHO we've tried to work a bit more on mental health, especially adolescents and youth. I think it's going to be quite a focus moving forward. In particular as well, looking at what has happened with the COVID-19 pandemic, and the impact it has, on mental health. It's huge, and how we come out of it, in the long term is going to be really key.
Yeah, absolutely. I agree with you on all of those fronts. Some of the very first work that I did with my collaborator, Dr. Nyandiko, in Kenya, is we were really looking at questions of adherence to medicines and starting to say, okay, this is going to be a long-term challenge. How do we support families in this struggle from, babies all the way up to adolescents to have children take these medicines every day? And perhaps the most surprising thing that immediately was could not be ignored was the role that stigma plays in that process. Just as you said, that it's stigma that prevents a mother from telling anybody else, even her sister or her closest friend, that this child is infected with HIV and needs these medicines. So she doesn't feel like she can ask for help because of that stigma. She doesn't feel like she can bring her community around her in the way that she might for another kind of medical problem or something else, even just regular childcare needs. We found that stigma was so often why parents were waiting to tell an adolescent even that they were infected with HIV, because they didn't want that older child or that adolescent to tell other people and have the whole family be discriminated against. And then the ways, just as you're saying, that having that living in, living with that stigma all around you creates this heavy burden that you're carrying, where not only is it shaping, who you tell, the disclosure of HIV status, not only is it shaping, when and where you'll take your medicines, but also that it's internalized so easily that way as well, that you start to believe that about yourself, that these terrible things that you hear, that only bad people get HIV, or that there must be something wrong with you because you have this infection. And I think that does then have such a terrible interaction with the mental health challenges, and just too with those social connections that are so needed for support, especially for adolescents in that way. I will, yeah, go ahead.
Yeah, I wanted to ask how's the work? So the work in Kenya, that's still ongoing or how?
It is still ongoing. And so, our, well, Kenya did have a very strict lockdown nationally with travel very restricted and people's movement restricted. They did open up more over the months of July and August. And overall, we were able to continue clinical services throughout, but with, of course, some significant disruptions in terms of, people's ability. We try very hard to provide longer stretches of medicine for people. But unfortunately, like many of even the healthcare systems here in the United States, budgets have really been cut for services. We've lost a lot of the support services that we would otherwise have, like for counselors, actually a pharmacist, even social worker, having personnel move from the adolescent and pediatric clinics pulled back to the hospital for more urgent needs. And well, I think our team has done, and in Kenya has done an incredible job of maintaining connections via phone and text and trying to make sure youth especially have enough of their medicines. It's been a huge struggle, and especially when more families are struggling, to even have enough food, and they've really lost, their minimum income as well. So it's a really challenging time. Cases in Kenya are increasing again as well, unfortunately. And so, that too, not only is COVID, of course, itself bad, but then it also creates again this fear that people have of coming to the health center because they hear, that there are patients with COVID there. Another way in which stigma can have, so many layers of impact in that way too. Of course, that fear is in certain ways justified, but of being afraid of the virus itself, but then to not, seek care that really is needed and to maintain, their medicines is another thing we really worry about. So, our team where I partner in Kenya, I've been partnering there for now more than 15 years, and the partnership itself between the medical schools and the hospital and the national referral system is a strong and long-standing one, and that's given us a lot of ability to keep things moving. But it is really difficult in that way. I wanted to ask you, sort of returning to what you were saying about the World Health Organization's increased focus on considering mental health issues in the midst of this, and something I've really appreciated from your leadership within the adolescent HIV global community has been the increased World Health Organization focus on issues of psychosocial support and what that looks like, and which has been a need, I would say, but then is even more so in the midst of how we figure out how to do it right now. I wondered if you could talk a bit about that in terms of, I think you've talked about why that support might be so critical, but ways in which the World Health Organization has looked at evidence, is starting to make different kinds of recommendations related to psychosocial support and also mental health considerations in the middle of things where otherwise we're thinking about HIV or even COVID or TB or things like that, how mental health fits in with that now.
No, that's a great question. So our work at WHO, the work on mental health, just like you said now, it goes beyond HIV now. It's mental health for adolescents, including adolescents who are living with HIV. So what we have is a cross-departmental focus on mental health. So I am with the Global HIV, STIs, and Hepatitis program. We have a separate department that focuses just on mental health. Last year, just because of the focus and, like I said, the priority that we give adolescent mental health, we have, worked between both departments to, for the first time, develop a guideline on adolescent mental health. Now, that is quite significant because, for WHO, the guideline development process, it's an arduous process, where we're looking at evidence, we're looking at, a lot of factors, even beyond the evidence. So to have, to bring together a guideline development group to focus on adolescent mental health, I think it's a big win. And just recently, that was completed and it was launched, at a meeting a couple of months ago. In that document, one of the standout recommendations is on psychosocial interventions. So psychosocial interventions to prevent, to promote positive mental health more positive mental health and well-being, to prevent depression and anxiety, but also other issues related to substance abuse, etc. So now we have at WHO a strong recommendation on providing psychosocial interventions to improve mental health and well-being for adolescent health in general. Mm-hmm. That document, you will see as well, what sorts of interventions, how they can be delivered for adolescent health in general. Mm-hmm. Now, on HIV particularly, we are currently going through a review of our consolidated HIV guidelines, which spans prevention and treatment. Mm-hmm. One of the research questions that has been focused on is on the mental health of adolescents living with HIV. So we have a PICO that looks at providing psychosocial interventions living with HIV to improve adherence, retention in care, viral suppression, a host of outcomes. There were about 9 outcomes that we're looking at. And we've been able to retrieve evidence, to support this guideline development process for this particular question. Now, I cannot currently, go too much into that because it's still, it's still embargoed. But in the next few months, we will be, rolling out these consolidated guidelines, link them with the adolescent mental health guidelines that I just spoke about. I think something to mention as well is that we are also currently, developing a toolkit. So a toolkit to support how the guidelines are implemented. Mm-hmm. So, you can make recommendations, but in the end, it's about how those recommendations translate to, to policy and to practice, mm-hmm. and how countries, absorb these recommendations and make use of them. Mm-hmm. Part of, the guidelines is not just to bring out the guidelines, it's also to develop more of an implementation guidance mm-hmm. that go along with it. So WHO, really huge priority, moving forward now and also moving forward.
Yeah. Yeah, and it's hard for me to express how exciting that is for our team. We can't see all of them, but our team in Kenya and here, one of the areas that our group has really been doing a lot of research in is on how do you provide models that do most effectively support adolescents in these challenges of adherence, of how do you offer peer support, how do you use mobile technologies to link adolescents together, even when they're spread far apart from each other, even in non-COVID times, but across rural areas, and especially too, how do you what are innovative strategies for offering counseling and peer support groups and those things when you have very few people who are trained to deliver some of those services as well. So obviously wanting to bring up that kind of training, but if you're in a place where the capacity is really limited in terms of who's available for that. And so, in that way, our group has been, I think, kind of a field innovation lab for testing these things. And we've been very privileged to be able to work closely with the Kenyan Ministry of Health at our collaborative HIV care sites to say, okay, can we see if this works in a small group? Can we try to roll it out across a number of clinics? Is it working? And then how do we think about scaling that up more broadly? But of course, to see it, so the reason my whole team is cheering, I'm sure, is because to then have the World Health Organization or others actually put that into their global guidelines and sort of reinforce from in many ways sort of the top or the big picture that yes, like this is exactly what we're trying to scale up. Like yes, these models work. I know you can't jump to like what the exact statement is, but overall, even thinking about mental health more broadly, these this support is so critical, these models work, to have that guidance so that, as we do really advocate kind of on both sides for why it makes sense for countries to invest in these kinds of services, why they really are cost effective, why they're critical, why they, do keep youth especially alive while living with HIV, that makes such a huge difference. So we're all thrilled about that. Like, even if a guideline in of itself doesn't sound, maybe for some of our listeners, very exciting, like it's really exciting news. So we're thrilled to have that moving forward. I did wonder, I wanted to ask you about the issue of both access to medicines and access to clinical services right now. As I mentioned, that's something over these months that we've continued to struggle with a bit. I think our partners at AMPATH in Kenya have done a tremendous job of, maintaining medication access kind of against all that's stacked against them right now. But I wondered if you could describe maybe more broadly what you've been hearing about supply chains, about access to medicines, as well as about access to other kinds of services for adolescents, particularly for adolescents living with HIV, as the pandemic has created, different kinds of disruptions than we would normally be thinking about, perhaps.
Yeah, so for me it's a deep question, because issues regarding certain things like what you mentioned, the supply chain, issues regarding data for adolescents, even other things like the health workforce, etc. These are systemic issues. They're health systems issues, and I think one of the things that has happened over time is that just like many programs, the HIV programs at the very beginning, started as vertical, more vertical programs that were, have separate structures, if you like, including, PMTCT. This was what happened, at the beginning. And over time, you would expect that, such vertical programs are sort of made more integrated, more horizontal, in a way that is sustainable. And I think that's one of the problems that we have with the supply chain. It is a systems issue, and one of the things that WHO has always talked about is strengthening health systems to be able to deliver, including the supply chain, logistics, and all sorts of management. Certainly is, it's quite, I think we need to look at it very critically, because it's quite, it's a bit of a shame, when you see, the first 90, which is, trying to get people tested, that's quite, it's an endeavor, especially for adolescents, to get tested, to see how we can create the demand. Sometimes can be quite problematic. Now, having invested, resources, time, testing the adolescent, it then becomes, more. That's why I feel like it's kind of a shame that, having invested all of those resources, we now have a situation where people on treatment or linked to care, there's quite a problem with it, and it's not a problem of navigation sometimes, even though we know we have problems with navigating. When it is a problem of, the supplies not being available, I think that's a no-no. And decades into the epidemic, I think it's a crying shame if we have situations where people get to facilities and they're not able to access medicines. What I would say is that we need to certainly, support these health system strengthening initiatives to help to strengthen the supply chain mechanisms that would make these drugs available. Also, very importantly, is we need to speak more about it as well. The civil society. We need to see how we can call these sorts of stockouts, for instance. We can call these out more. We need to be able to bring them to the to the limelight, for people to understand that actually when we say that ART coverage for adolescents is really low, what we're actually talking about is actually that some of the supplies are not there. Some medicines are actually going in, but they can't access the medicines, and that is something that needs to be brought more to the forefront and talking about more clearly.
Yeah, I completely agree with you. Of course, but it's so true. I mean, it really is a shame that we do say these things like, oh, ART coverage, it's only 50% or less for adolescents, and what that translates into truly is this really shameful state where globally, we've had these medicines that we know. Again, let HIV be something that can become a chronic disease you're living with and managing and growing with and doing all the things you would be doing with otherwise. And yet half of the youth who have this infection do not have access to these medicines still. Like 30 years in, we still don't really have that for half of the infected youth. Like that level of the disparities of the ways in which there's real injustice around that, and how our systems make that even worse, that there might not be the specific medicines that are needed for kids or youth. Or we often do run into the issue that many of our adolescents are still very, very small, especially those who are born with HIV, and that means that they're not yet big enough for the medicines that are created along thinking of adult weights, essentially. That for those who are familiar with pediatrics and child dosing, we give amounts based on how big you are, and once you're an adult, we say like, okay, this is the adult amount, you're fine. But many of our youth don't yet fit into that category, and that means that we have even more limited options that are available for them. And so and I think, just as you're saying, that is something that our teams really struggle with on the ground, that maybe they have some medicines available, but they don't have the specific formulations, or there are shifts, or they have to change someone from one regimen to another because something, is not accessible at the moment, or we have youth who, are still taking and younger kids too, really, really complicated regimens of, pieces of 6 different tablets that they're taking twice a day to get the right dose of these medicines, where ideally we have in existence other places in the world, a single tablet that includes those 3 medicines that can be taken. So there's definitely a lot there. Let me just pause for a moment for those who are joining us to note a few people have started to write in some questions for us in using the Q&A box, and please do feel free to do that. I think maybe one to start with from that group, Wole, there's a question saying, whether we've considered or looked at COVID-related stigma and how COVID-related stigma might impact adolescents who are living with HIV and their families. I wonder if you've heard about this or any thoughts related to that from what the World Health Organization is gathering.
Yes, it's a very good question, and yes, that actually has been part of our focus and the work that we do at the World Health Organization. So just recently we released a Q&A, so a question and answer sort of fact sheet for COVID and adolescents, and takes into account what question as well. You would have seen, the news as well. There's a lot of finger pointing in terms of who is breaking the restrictions, who are those who are not maintaining physical distancing and so on. I think we have a responsibility to push out the right message. Right message here is that the vast majority of adolescents and young people, actually are, trying as best as they can to follow, the rules and the regulations that we even though it's much more difficult for them, like I mentioned, it's never easy. We all can remember, being, that 15-year-old, 16-year-old. It's more difficult for adolescents, but the majority, let's be clear about this, the majority are following the rules, and all of those. Now, so that creates, of course, when the wrong information, this idea of generalizing, you push that sort of message out, that can create, apprehension, it can create stigma, but also it's important to get information out as well in terms of how adolescents can, protect themselves, how can they live their lives even in the midst of a pandemic. And that is why, working on this, Q&A, this fact sheet on adolescents and COVID, we've been able to, bring out some of the most important questions, including one that has been asked on stigma, on, what can adolescents do when faced with a certain situation? What can they do? What is the advice? I think that's a good one that we can look at, and also to say that it's also being regularly updated. So because things change, I mean, where we were a few months ago on COVID is not where we are now. So there is an opportunity as well to update this. If there are questions that you feel should be, because there's a time when we're going to call questions. What sort of questions are being asked, or what sort of questions are not currently answered? That should be Q&A. Rachel, I'm very happy to be able to get these sorts of questions as they come, and then I can share it with my colleagues here to see if
that's terrific. That's and I think I actually think how the WHO has been very clear about trying to point out the infodemic that we're also in, this idea that there's this massive amount of information circulating around us too, much of which is misinformation, or there are different ideas about what should be going, and how difficult that makes it for everybody, but especially here as we're thinking about youth, to be able to really pick out what is true, what should they believe, what do they follow in this. Our group, it's interesting, and I'll have to share these with you. In our partnership in Kenya of the Arnhold Institute for Global Health, we have a design team that worked in a process with a number of our youth in Kenya virtually around some public service announcements, some messages that would be COVID focused, and they co-designed with the youth some really lovely kind of shared graphics, but that included information about things like wearing masks, keeping separate, a certain amount of distance from each other, what it looks like to clean things appropriately, and washing hands. So fairly straightforward messages, but really worked with the youth around their specific ideas of how to convey that information, what it should look like, what words to use, what colors, even to use in the graphics and those things. And I think it is really critical, to consider how we provide information to youth in ways that they have a voice in as well, so we know what their questions are, and then can figure out with them, how to provide answers that make sense that way as well. So I've really appreciated our systems designers who work in that process to say, okay, how do we integrate voices that way?
Who's that question from? Do you know?
Oh, I don't know. They're
That's a good question. I like it.
Yeah. So there's a question here about and maybe we'll just touch on this because everyone can't see it. So I'll read it. Oh, so the last one that we have here. So it's, I know the COVID pandemic has been a huge challenge for the HIV/AIDS community, especially in at-risk groups of adolescents. But are there any COVID-19 messages about mental resilience, health awareness, taking protective precautions that the HIV community might leverage in helping adolescents face the sensitive issue of HIV prevention, testing, and treatment? So I think thinking of that interplay to how we're communicating across them, which perhaps is another question for our group to think of specifically, but I know you, Wole, do a lot of work also related to issues of prevention of HIV, uptake of HIV testing for youth, and how we move forward with that as well. I wondered if you have thoughts about that.
Yeah, so there's I think the simple, well, the clear answer is there are quite a lot of resources. Well, and I think this probably speaks to the question as well. Not just resources, but resources that are tailored to adolescents. So friendly communication, images and tools and videos that on prevention, on testing, on mental health that have been developed over time during the beginning of this, from the beginning of this the COVID-19 pandemic up until now. There have been quite a lot of those resources at WHO, and like I said, it's evolving, isn't it? Evolving situation, and as the need for these resources, come, happy to also, look at them. That's why, I was asking who asked the question. Yeah. I can, as these, needs come, if there's specific needs, if you think, okay, we're not enough of this, I'm absolutely very happy to take these on board and see how we can develop, more tailored communication. Now, I have to say, Rachel, Rachel, I can send you those links as well if you want to share with.
That would be terrific. Yeah, and we can post them too with.
We can post them as well. So yeah, there's quite a lot of that. Yeah, that
would be great. So maybe one more question from the group here, because I like this one too. So how could adults around the world learn from adolescents living with HIV about advocating for their own health as it might pertain to COVID-19 or chronic diseases? What can we old people learn from adolescents here? There's so much we can learn all the time. I'm being taught. Like, what are your thoughts about that? You an old person, of course. I'm
yeah. Again, that's a brilliant question. It's a brilliant question because just probably a couple of days ago, we were speaking about it's 10 years to 2030. And there's a target for 2030. That target to end the AIDS pandemic, the AIDS epidemic by then. To do that, we're going to need to rechannel our efforts. There's been a bit of a lull, if you like, especially in the last year with the COVID. We're going to rebound with energy, with vigor, with verve, with swag. I think that's my younger friends say as well. So that is something that you find in abundance in adolescence.
True.
If you want to re-energize, this great cause, if shooting high at that time, at 2030, we need renewed energy, commitment. That will come from young people. There is no one does it better when it comes to bringing that sort of life into what we want to achieve. And you need that because after some time, you can see people talk about fatigue, donor fatigue, program fatigue. You need something, you need a spark, and that spark, I think, can come from adolescents and young people.
I think that's the perfect place to close this part of our discussion, that that if we really want to achieve these goals together of ending the HIV epidemic, of heading towards this big target, we so need that youth energy, that spark, just as you're saying, that ability to really reach for the future in this way. And I guess that's where too, even at this milestone today, is here we are in 2020, looking ahead for the next 10 years. on this World AIDS Day. I think we both want to support and do what we can for the urgent issues of youth today, but also how do we follow their lead and support them to be able to be, the true leaders and heroes in this and the path for the future. So thank you so much. It's been lovely to talk with you. I feel like we could easily talk for another hour, but I appreciate your time. And I know World AIDS Day is, of course, a very full day for you. So I really appreciate you taking the time to join us today. Thank you so much.
Thank you so much. It's my huge pleasure. And thanks to everyone as well. Thanks to, Rachel, to Amanda as well. I think Amanda is somewhere. It's great. And I would be happy to, always, answer the call whenever you need me.
Appreciate it. Thank you so much, Willie. And we'll be in touch, and we'll make sure to post to, and for everyone listening, we will post a recording of this time, and also we'll make sure to connect to some of the resources and guidelines that have been mentioned. So thank you, Dr. Ameyan. We really appreciate it.
Thank you very much. See ya. Bye.